Welcome to the Availity On Air podcast. I'm your host, Matt Schlossberg, Director of PR and Communications at Availity, and I'm thrilled to have you with us today. Availity On Air is a monthly healthcare technology and business podcast for provider and health plan professionals at the forefront of technological innovation. In each episode, we'll uncover the transformative power of cutting-edge technologies like artificial intelligence, data analytics, and interoperability, and explore how they're reshaping patient care, operational efficiency, and the overall healthcare experience. Whether you're a provider, a health plan executive, or a technology developer, Availity On Air equips you with the knowledge and insights you need to harness the power of technology for positive change in healthcare. I'm very excited to introduce two guests today, Jesson and Zafar and Dennis Kramer of Sentara Health Plans, to discuss how to drive transformation and innovation more effectively in complex organizations. From product development and marketing to executive investment and communications, bringing new products and services to the market is a complex challenge involving dozens of stakeholders across an organization. Done right, a new solution can dramatically impact both the healthcare ecosystem and the organization's bottom line. However, far too many organizations grapple with internal bureaucracy and competing goals and motivations, and that's just for products already identified as part of a solution's roadmap. For those who have ideas they think are worth developing, the process of bringing a product or service presents an even more daunting gauntlet. If this sounds like your organization, Jesson and Dennis are worth listening to. They've developed a transformation center that literally brings ideas to life, and from all corners of Sentara's organization. In this podcast, Jesson and Dennis discuss how they created their transformation center, how it works in practice, and how they have engineered their process to ensure that good ideas, regardless of where they come from within the organization, are given a chance to reach their full potential. On today's show, we'll break down the process of transformation and innovation and how applying process and support can make those concepts more than mere buzzwords. Okay, that's enough for me. I hope you enjoy this fun and informative conversation with Jesson and Dennis. Well, Jesson and Dennis, welcome to the podcast.
Thank you.
Jesson, I wonder if you could kind of kick off and tell us a little bit about yourself and some of the work you're doing within your organization.
Yeah. So first of all, thanks for having us both here today, Matt.
Absolutely.
So I've been at Sentara Health Plans, the health insurance side of Sentara Health for a year and a half now, and largely responsible for digital innovations related to the health plan. So my specific role is Director of Digital Innovation. I lead a team of 15 people responsible for digital operations, experience. So there's a digital experience within our channels, be it public-facing website, member portal, and then also supporting the mobile app, and then also working with the different teams that are related to the provider portal, employer and broker portals as well, and supporting them. And then also this new kind of element to our team, which is business development. So digital business development, exploring tools and opportunities in that space.
Okay. What about you, Dennis?
Hey, Matt. Thanks for having me here. So my name is Dennis Kramer. I've been with Sentara 4 years, director in our digital solutions. We live in IT, so we go across all of Sentara, and as an IDN, we have our hospitals, our ambulatory practice, as well as our health plan. So we support digital supports across all of those. Right now, one of my main focuses are agile maturity. So we're not a completely agile enterprise at Sentara, not yet. Most of our agile practice lives inside of digital solutions. So one of my main tasks is maturing those teams and overseeing those spaces, as well as engaging with our employer portal, our provider portal, and our patient portals across the health plan and the ambulatory side. As well as engagement with our transformation office. So in 2023, Sentara had a big year, actually. I still feel like the year is going, actually, but 2023 is now 2024, but 2023 was a really big year at Sentara. We kicked off last April our transformation office, and one of the work streams is our consumer experience work stream, and I'm heavily involved with that, mainly in connecting our initiative owners from across the enterprise into our CX teams and really letting them know the importance and how CX can really set them up for success with their initiatives and how we engage with our members and patients. So kind of a little bit of everything. What's great about being in digital is we kind of were starting to expand and touch a lot of things that we hadn't previously. So our digital teams, Jesson's now here in his role, like a newish role when he got here, is now, I think we're finally kind of starting to see digital as that intersection of, the in-person experience and where it meets our IT. And so it's a really exciting time.
So I've heard a lot of organizations talking about transformation, and Availity is no exception. And it's an exciting word. I think it inspires a lot of people, but once you kind of take a peek under the hood, it gets a lot more complicated. So I was wondering if I could talk to you guys a little bit about when you think about transformation at your organization, like what are some of your mental models or first principles to kind of set up the culture to accommodate transformation, particularly as it pertains to digital technology use?
Yeah, Dennis, you want me to take that one first? Okay, so I think first and probably foremost, it's important to know that any transformation, and especially digital transformation, just because digital has become this thing which is just so permeated across an organization that everything is digitized now. And so what you're talking about is a full transformation of an organization. That means how people work. It means the systems you use. It means the processes. It means just how consumers interact with your products. So I think going back to your question, you start with the culture of an organization, which means that not only does the organization have to buy into the transformation and why you're doing it, because change it's change, and change is really hard for people, and really hard for organizations. But you also have to have those processes set up that enable transformation. But most importantly, probably everyone has to buy into it and in a day-to-day from a day-to-day perspective, show up enabling that transformation to happen. Otherwise, we can talk all about transformation all we wanted to. It's not going to happen effectively. It's going to take forever to do, and that's not good for your consumers at the end of the day. So I think twofold. I think the importance where you start, the foundation is culture, and making sure that people buy into that culture and act on it.
So Dennis said that your role is a little bit newer. So, in some ways, are you kind of defining what your role is? Are you what sort of experience have you had in transformation, whether it's within healthcare or other industries? What sort of would you consider some of the prime lessons that you're bringing into Sentara?
Yeah, so I would say this, and I think Dennis could probably say the same or something very similar, is that by the time my career began, I was sort of a product of transformation because of the nature of which digital just happened to be there. Digital just happened to be adopted by the time I started my professional career. So naturally, I was having this conversation earlier today at lunch with Alicia. So naturally, I was the youngest guy to get the digital stuff at my job. And even though it wasn't my purview, they were just give it to that guy. He just came out of college, he knows how to build websites. And so anyways, I think that shaped what I did at that job. And then it also shaped kind of the professional that I am today, and what I do and why I do, what fires me up and what I'm passionate about, because I was kind of thrown into the fire. And at that stage, you either, figure it out and it kind of builds you, or you don't and you fail. And I failed quite a bit along the way. But anyways, I think, when it comes to my role here at Sentara Health, they hired me to bring a little bit of that external from healthcare experience, and which I did. I came from a retail background, as well as digital, and I think when I got to the company, I quickly realized that there was many gaps, many opportunities. Foundationally, Sentara Health was doing some awesome things. Institutional knowledge and the culture and just the excitement and, quite frankly, the passion around which people rallied to their communities and to their members and servicing them properly. the stories that you hear about hospitals just taking care of people like literally one patient at a time and getting super personal with them. You don't hear much of that anymore, it seems like. That's what attracted me to come work for Sentara. That's why I came here. And what drives me every day is doing what I do, which is coming in, identifying those areas of opportunity, and then rallying a team around that common mission, which was, hey, how do we start to think about digital from what Dennis's point was, which is enabling the business and technology, traditionally technology-related departments, to come together around a common cause, and especially think about it as we would a problem that was, if we lived outside of healthcare, how would we think about, if we were selling a product in retail, how would we think about launching a product to a consumer? Well, we would examine the experience that consumer goes through. We would understand their journey. We would understand those moments of truth. We would identify the gaps, and then we would invest in solving for them. And it kind of blew my mind why so many companies in healthcare weren't thinking about it that way. And I'm not quite sure why that tends to happen or why that has happened. But Sentara is obviously thinking about how do we bring people in from outside of our traditional kind of, traditional business and business model. How do we bring people with different perspectives? And I think that is like this weird, I think about atoms reacting in this environment. I think it's an accelerator of innovation, and transformation goes kind of hand in hand. So anyways, probably a long-winded way to answer your question, but yeah.
That actually leads me to a question I have for both of you. Now, I'm of the generation that existed at some part of my life in the analog world. And then this next half, I'm existing in the digital world.
Yeah.
Right. So, I think what's kind of interesting about that is for most of my career, most of my life, technology was just something that was done in the background. Like that was like the backroom guys. You never really kind of saw what they did, why they did it. They just kind of presented a finished product. Whereas today, what you're kind of describing and what I'm kind of seeing is technology development and application as being something more integrated and collaborative. Am I kind of on the right circuit there?
I don't think there is a difference any longer. And I think if you do think there's a difference, you're probably not going to last very long, no matter where you are, because it's simply a tool. It's just like, it's probably one of the greatest tools we have for delivery care, just interacting with our members and patients. But I want to go back maybe real quick to some of the stuff Jesson was talking about just a moment ago. And I think it relates to your question too, of there's like the concept of digitizing versus digital transformation. And like digitizing is taking a piece of paper and making it a PDF on your computer, right? You've not really changed anything. You've made it from you writing with your hand to you typing in, but you're still doing the same thing. It's maybe a little less painless, but it's not transformative, right? You're still filling in all those fields, the same forms you get over and over at the doctor's office or, wherever you are. And so we're trying to look beyond that. And a concept I came across when we kicked off our digital transformation, even before our transformation office stood up enterprise-wide digital, we had a transformation that we kicked off. And I came across a concept of better sameness. And how do you avoid better sameness? And better sameness is taking a piece of paper and just making it a PDF. That's not really doing anything different. So we set off on a quest of 10 signature experiences where we looked across the enterprise and the plan on the provider side is everywhere, whether it's in even bill payment, all parts of the organization, and how can we make these signature experiences. So we set off on a quest to complete 10 signature experiences in 2022. And we almost got there. I think we did as well as we could. We were driving things completely differently than things have been done at Sentara, but we were bringing together on our digital steering committee groups of people that previously had never met before. Health plan was on it, ambulatory is on it, hospital on it, marketing is on it. Our CX teams were sitting in it. Really the focus of it was now CX. Like how do we put the consumer, it's Jesson's point, like we need to think differently. Like how would retail do it? How would banking do it? Putting that consumer first. So our CX teams are now like heavily embedded across all of our initiatives. In fact, like when you're starting an initiative in our transformation office, one of the very first questions you're asked is, does this initiative impact a consumer? And if the answer is yes, you get routed to our CX teams.
Could you give an example of a signature experience that you guys worked on?
Well, actually, you want to talk directly about the one.
Yeah.
Why don't you talk about the Mammo one?
Yeah. So when I think I said I had been here for about a year and a half. When I got here, Dennis and team had already kicked off the signature experience work. There was an initiative around care gap delivery that I was kind of handed and just said, go run with it. So what we started to look at was, what areas, chronic conditions specifically, were opportunities and why were those opportunities? So we know they're a big problem. We know a lot of people have multiple chronic conditions, but hypertension, diabetes, and then cancer-related issues too. What I like to do is ask like very basic questions. Like I'm a pretty simple person, and coming into health insurance, which was super complicated, kind of where I started was a simple question with this project, and it was like, why don't people get the care they need? Turns out, as we started to kind of dig into it, we didn't even do a great job of notifying them or alerting them that they had a benefit. It was free to them, and we were there to support them with what they needed. Now we need to get them to take action. So it's like, okay, half of it is me. I'll meet you halfway, and then half of it is on you. And we know too from adherence, a lot of people don't get their labs done. A lot of people don't they get their lab results done. They don't follow the adherence. They don't take the prescriptions. The same is very true for chronic conditions. And as it relates to where we targeted with that signature experience, it was we felt like targeting women at kind of like a high risk age of developing breast cancer. Mammograms were a great way to go. So that's one simple thing we can say. Look, we have this care delivery imaging center which is close to you. We identified the footprint of which those people were, and we alerted them that they were due for their mammogram. And also, I think the other interesting component with that, and something that sort of emerged along the journey of answering the question with the team, was we were delivering messages related to mammograms and asking patients to sort of follow up with that in about 11 different ways.
Mm-hmm.
Which was, for an IDN, it was like a good problem to have, I guess, because we were like, hey, we're broadcasting this out there. But with anything else, when you start to get that many messages from that many departments, and it comes in, like you may be getting it, and you may be like, hey, I just got my mammogram done. Why am I getting a message a month later to come and do it when I just did it? Or maybe like I got it done, and then I'm, not able to I'm getting a bill for like why I did it when I was told it was free. So anyways, when we started to get into that project, we quickly realized like, hey, there needs to be some consolidation around how we deliver that message, as much as there is just making sure that people are aware of it.
That, it's Jesson, when you asked, how successful were the signature experiences, to say, I think actually internally they were probably more successful than externally, because to Jesson's point, it actually alerted us to a lot of concerns and issues, like the consumer data hub that we're now developing, like within IT, to have a single source of truth for consumer data instead of it being spread around. That's why people are getting contacted. One system has this data store, they're sending out emails, and other systems sending out text via that one. So we were completely siloed with a lot of our data stores, and that's why you're sending out. They don't know that information was sent, right? So now we're going heavy into some omni-channel spaces to just give our employees better tools to serve our members and patients. And I think that was actually one of for me, the best like positive externality of these signature experiences was actually finding out some problems and actually then addressing them internally. And some of these signature experiences we did have to put on hold, because we said we can't even do this effectively until we fix the data issue first, or whether that was provider data, patient data, et cetera. That was one of the phenomenal actually results of the signature experiences, was actually pushing some fixes in other parts of the organization, which was great. I think too, and like something, Jesson's getting to, you talk about the tools that you have. And I think that's been a big revelation for us in not just in digital, but around the whole organization. We push a model called the 4D model, which is define, design, de-risk, and deploy. And it's that de-risking stage where you're testing your tools, you're testing your methods. getting your compliance straight, that's a step I think is very easy to overlook. And then you wonder why your deployment fails, or you're redoing it, or you're fixing, your requirements are changing mid-deployment over and over again. It's because you're not de-risking properly. And I think that's something that's part of it's now kind of a step in the transformation office. You have to do these de-risking steps. But I think that's kind of one of the larger things that we're doing now to ensure we're hitting the right people at the right time in the right way, is going through your de-risking activities. And it ultimately makes you go faster. And I think that, earlier today we heard a ton about moving things to the left. And I was like, oh man, that's my favorite phrase. I say that all the time, which is very funny. It's just very true. That's like how we say the more things we can do in the define and the design stage, your de-risking becomes easier. And then by the time you get to deploy, and we're setting this off to our teams, or the development teams or operational teams, they can just go and run with it. And that's the best part. We want to set them up with this great package of work to let them then go run and operate. So, because at Sentara, we have fantastic operators, like people, like Jesson said earlier, like long-standing, phenomenal people. That the knowledge there is really unmatched. The longevity people have, even at 4 years at Sentara, I still feel like an infant.
Mm-hmm.
Just at a year and a half, I mean, you're like, you're barely even walking, right?
Yeah.
So
Yeah.
like, it's just one of those organizations, because the culture is very strong, like a lot of really caring people. But now we're taking that mix of really caring people and pushing ourselves with the more modern methods. And I think the results are pretty fantastic.
And it sounds like the culture and even the standards that you're setting up for transformation allows new ideas to kind of come from all corners.
We were just talking about that actually
does.
at lunch. Yeah, I mean, we have our transformation tool that has a bit of a limited scope to it, but we are actually now bringing in a new tool soon that's going to be enterprise-wide to take in ideas. So whether you're in a nurse's station at one of the hospitals, or you're in the call center for the health plan, wherever you sit, you'll be able to send in your ideas, and that's really kind of like the birth of the transformation. So Sentara was 30,000-ish employees. We'll get phenomenal ideas in a matter of days, probably when that platform goes live. So we're looking forward to that.
And it's been really, I think, useful, helpful, valuable for the organization to have it go top down, bottom up. So basically, all the way up from the CEO, Dennis Mathis, down to the day-to-day worker in a hospital or in the health plan. The direction for transformation has been set from the top, but they also understand that the best innovations don't come from leaders or even like directors like Dennis and myself. Like, we don't have those great ideas. Those great ideas come from the people who are like in the trenches, boots on the ground every single day, who know where those problems are. And then it's up to leaders like Dennis and myself and others across the organization to help enable that. And, and quite frankly, that's when we talked about your first question, which was, how do you build that culture? That's what I mean when I say like helping people wrap their heads around what this is, and also empowering them, because most people are not naturally empowered to go out and just like own an idea from concept to reality and get it, get hundreds of thousands, if not millions of dollars invested in it, and feel like they are the owners of that idea and the owners of like that. It almost becomes like a little business in itself within the larger organization. That is how innovation happens, and one way. And anyways, it's top down, bottom up, and that's really, I thought it's been exciting to see it.
So I definitely see the opportunities and potential in what you guys are doing. What would you kind of describe as some of the chief challenges or headwinds in terms of, transformation? I got to imagine, particularly in healthcare, that has a reputation of being slow to adopt technology. They do kind of take the long circuitous route to adaptation. How do you kind of deal with that?
Yes. So it's funny. A lot of my early career was in banking, consulting. Banks took forever to transform as well. Highly regulated industry, very similar to healthcare. However, banks have banking hours. They close, the kind of the joke of he keeps banking hours, right? They close. We don't close. Sentara doesn't close ever, right? We have, 12 hospitals. They're obviously open 24 hours a day, 7 days a week. Yes, the health plan does maybe takes, but not really. I mean, the call centers are open too. So when you have an organization like an IDN or any healthcare, it's not unique Providence Sentara, but when you have to operate 24/7 and someone's life is on the line, you don't necessarily have time to step aside and let me think about this next transformative idea when I have to now do my job as an operator. So I think that's the challenge we've had is, like we've mentioned a couple times throughout here, like we have fantastic operators at Sentara, which is deep, deep knowledge. The challenge is getting someone to step out and pull themselves up out of their day-to-day to kind of look at themselves, not just look at themselves in the mirror, but from maybe a top-down view of what's going on in their day-to-day life and how can I now redesign this, de-risk it, and then deploy something new. It's a very challenging thing to do.
This is more of a logistical question, but when you were talking about your signature initiatives earlier, and you had talked about convening disparate stakeholders, and that kind of gets to what you were talking about. Like, how do you get those folks in the mindset to get out of their day-to-day and to approach a problem a little bit more collaboratively?
At the time, I don't know why people came. I think we were just doing something new and exciting, and so it felt fresh. My boss at the time was new. He had done similar things like this before, so I think it kind of conjured up some activity of, okay, let's try something new. And I think that the promise too of, okay, actually something I'm going to do here is going to have a positive impact on a patient or a member like instantly. It's not going to be a long-term thing. We're not like, these are signature experiences for a reason. We picked moments like, Justin's example about mammograms that are like, these are real things. Even if we impact one member or one patient, that was almost worth it, right? Like to kind of
it could save somebody's life.
It could save someone's life, right? Yeah. I don't want to be like overly dramatic about it, but that's the truth. So even if it's one person, okay, it was worth this time. But and I think from that too, we kind of really saw this value of, oh my goodness, we're doing things in the health plan, but on the provider side, the ambulatory side, well, yeah, but the same goal. It's better outcomes. That's what we're all after, is better outcomes. And now what's fantastic is across the whole organization, we have our One Sentara strategy, which rolled out last year as part of our transformation. And that really is, how do we best operate as One Sentara? We have a health plan, a growing health plan, a very solid base of ambulatory and hospital provider side. How do we now leverage all of that and our incumbency advantages to make things just more seamless and simple for our members and patients, especially if you're in what we call the purple space, which is a member patient, which is myself. I don't know if you also have Sentara Health Plan as your
we
health
do.
insurance. Yeah, okay, so you as well. Like, we are in the purple space, which means we are a member patient. So this is a person that you should be able to care for instantaneously, and everything about them. You shouldn't have to ask them to fill out any pieces of paper. You shouldn't have to ask them about what coverage you have, what's your deductible. All this information. So we've set out a lot of our transformation initiatives are specifically focused on that One Sentara space. And it's a growing number of people. Obviously it's a subset of our patient and member population, but it's enough of a population that we can have a big impact on how we provide care.
How would you describe your current state of transformation now compared to maybe where you want to be 5 years from now?
I think now we're still back to the point about being great operators. And again, this is Dennis's personal opinion. This isn't like a Sentara opinion, right? But like my personal opinion on is that we have taking an operator and asking that person to now be a transformation leader of an initiative is a difficult thing. And we're not even 1 year into this. But now you're finding folks who are, oh my gosh, they're like kind of addicted to being an initiative owner. They want the initiative. Like, okay, this one's already launched. What's my next one? So you're now actually starting to see a lot of excitement grow around this concept of initiatives and getting it launched and, getting my funding set. And people are now starting to think in a new way. And when they see it to come to reality, and now we're at the point where our first set of initiatives via the transformation office are now coming to a reality and producing value, like real measurable value. I think people are getting a little bit excited on it. They're stoked. They want to see it grow. And we're about to do another another bottom-up planning event here fairly soon for like our next set of ideas we're going to come through. So I think in 5 years, it will just be our way and it won't be the new thing. Right now, it's still kind of, oh, it's for the transformation office needs this and I'm doing this for transformation. And what I would love is just to say, I'm doing this, not for the transformation, but I'm doing this, I'm doing this for the patients, I'm doing this for the members. That would be like my ultimate goal in 5 years. If we remove, not that the transformation office needs to go away, not suggesting that, but if that can just be our ethos, then we know we've had a success,
Just for clarity, that an initiative owner isn't necessarily a member of the transformation office, right?
No.
They may be coming from elsewhere.
Yeah, absolutely. The transformation office is relatively small.
Yeah.
We have our chief transformation officer, and then, maybe a dozen or so folks that like fall in there. And then, obviously, consultants as well mixed in. But no, IOs come from anywhere and everywhere. And that's what's fantastic about it. It's just kind of the crowdsourced mentality, I think, also that's come about has been really great. And you can be, we've seen this a little bit too. You can be someone who lives in the health plan and working on a provider initiative or vice versa, just because you might have the wherewithal or the bandwidth or really just the drive to do it, which has been an exciting thing too. It's getting people talking to each other that never had before.
So obviously your goal is to make this replicable across the organization where it ceases to be a quote unquote transformation event and just this is just how we operate on the daily. So for an initiative owner, I'm assuming you provide resources, boundaries, kind of mentally and kind of physically prep them for the journey ahead.
Yeah, absolutely. So, in the transformation office, you have support from finance, IT, consumer experience, change management, process improvement. I'm probably leaving out
HR.
Yeah, thank you, HR. Yeah, because yes, for recruiting and other things. So you have support across, across corporate, all you need really. And what's I think great about the transformation office too, in the way these initiatives funnel through, is that the workstream leads, these are typically senior vice presidents, and workstream owners or executive vice presidents. So you're also getting a great experience for people to learn how to put together their business case, how to present this now to, my boss's boss, or something, like to really get that buy-in, which I think has been a phenomenal growth experience for a lot of people to get that experience in there in front of the executive audience, and learning how to put these things together.
And I think just to add on to what you just said too is what we've heard is that the inherent learning about the organization when an IO goes through that rigor, they're just like, I had no idea that this team did this thing because I started this initiative and then I started working collaboratively, like Dennis was saying, in the purple space or with a joint team of care and health plan members, and they just emerge with this new perspective. And that's how leaders grow. That's how, the business grows.
So if I was a peer of your guys's and I wanted to do something kind of similar to what you're doing, setting up a transformation office, scaling this sort of idea factory, what are some of the basic standards that you feel need to be on my checklist in order for me to pull this off, not just in terms of personnel, but also mindset?
So I would say mindset wise, like you have to be willing to grow, which means you have to know what you don't know, and and you have to double down on your strengths. And I guess I liken it to sort of running a marathon. That's what it feels like to me sometimes. It's really hard work and takes discipline, sprinting a marathon, but then you got to pace yourself. But you're building a muscle. Like no one. I was talking to Dennis coming from the airport. I signed up kind of haphazardly for a half marathon, and I'm not a runner by any means at all.
Same.
So I'm like, man, did I just totally screw myself over? But at the same time, you kind of need that kick in the butt because I love the I love the Colin Powell quote that Russ kind of mentioned at the very beginning of the meeting, because you're never going to have all of the information or data or support or, whatever you're going to need to get started. No, just get out the door, and the rest will kind of happen in a sort of weird, beautiful, organic, sort of natural way. And I think that's the first, like, kind of the mindset that you need. It's a very entrepreneurial mindset. And then as far as the processes and the investments and the structure goes, I don't know, Dennis, you probably know.
I mean, I think you have to have your guardrails right? And that's kind of part of the rigor of going through the transformation office and getting your initiative approved. You do want that person to go out and go get it, and it's up to them, right? I mean, we say you're the CEO of your initiative, so that it's on you, right? And Jesson said earlier, it's kind of like your own little business, and it is, and people have really, really taken to that concept. I think you need those guardrails. That role clarity is very big. Even defining what is an initiative owner. Is this now my new job? Is this like a lot of one question we have a lot as the planning started and the transformation kicked off was, so I do this into addition to my other work. I was like, no, this is the work. No, this is your work now. And if anything you're doing, it needs to be done in this way. So there's also kind of that philosophy of I'm going to commit. You have to have someone committed to do it in this new way. If not, I think you're going to be pulling yourself in two directions, and that's not sustainable. So you're kind of changing from, oh, this is a side thing to this is my work. This is how we work now. And that just takes time. I love Justin's point though, just like get out and do it. I know that's kind of easier said than done, but with that, I think also comes that you have to have a sense of humility that you are not going to have all of the skill, all of the capacity to do what you want to do currently sitting within your organization. That's just not feasible. It's not realistic. So I think also kind of a little taking some of that humility and then applying it to going out and seeking the best partners that you can is a huge part of transformation, because you have to mix it up. Right? Like you have to have someone come in, a vendor who's come in and said, well, we did this in the banking sector. We're doing this for, in a retail sector, and this is how they did it. This is their approach to engaging their consumer. So without bringing in vendor partners, I think you might struggle with better sameness. And I think it takes that outside view, not all the time, but many times it takes that outside view, and sometimes to be that just what gets you over the fence of like, transformative things. So I think you have to have that recognition. I mean, that's how we operate at Sentara, at least in digital. We've found ourselves tied in with some fantastic vendor partners, and not just product partners like Availity, but just people to do the work as well. That has really allowed us to move faster and just better. You have to go out and find that talent that can do it. So I think you have to be committed to that too. Is that you may not have everything in the room right now, but you get started, and you just got to get started, and then you go for it from there.
One interesting problem that sort of arose that I didn't really fully appreciate how big of a problem this was related to what Dennis was just talking about is the fact that we have so many workers that are remote right now.
Sure.
And you have a lot of teams which are newer, employees which are newer. Now you're asking them not only to take on this initiative, but go find, to Dennis's point, go find the right people to work with. And they're like, who is that? How do I get in touch with them? I sent them a Teams message. I sent them an email. I tried to book time with them. They didn't respond. And then when they land with them, they don't get the answer that they necessarily needed. So if we were to like kind of rewind and go back pre-COVID when everyone was together, dealing with that barrier is much easier because you could just walk down the other hallway and go talk to somebody in the next office, or be pointed in the right direction, or bring people together, have a hallway conversation or whatever.
We're starting to do some of that a little bit more.
There is a little bit more going on.
Yeah, we have a beautiful new facility.
Yeah, that's right. Yeah. And there's definitely like serendipitous moments that happen with that inherently is part of that structure, what people need, what organizations need to be successful with it. But it's a huge barrier. Just that one little thing is such a huge barrier. And it's been an interesting challenge to sort of tackle.
For sure. Can you talk to me a little bit about how you guys talk about yourselves and kind of promote the transformation office and what it does, and getting people not only on board, but even understanding what it is so it doesn't kind of turn into a black box at your organization?
I think I've actually probably used it more in recruiting when I have been bringing in new team members, of letting them know you're coming into Sentara at a really exciting time. And what's funny is that even 4 years ago when I joined, I thought the same, and we weren't even doing our transformation yet. We kind of heard the health plan is expanding. We're doing these new things. We're always, upgrading something with Epic and getting, some new features with them. So there's always something even before, there's always something I think exciting going on at Sentara. But now even more so, I think for me, I've used it in recruiting. When, talking with potential employees and contractors about why it would be exciting for them to come to Sentara right now, and get on board with us as we're growing and transforming and, modernizing how Sentara works. So I think, that for me is that, but, something else, I was just telling someone earlier, we were talking about this, is the change story. I think I called it a transformation story earlier today and I misspoke, but our change stories. And we've kind of gotten out of the habit a little bit. Probably actually need to get back to this and remind myself to get back to this with my teams, is kicking off meetings by telling your change story. And that is someone offering up 2 to 3 minutes. Doesn't have to be anything long or, a crazy story about, a family member or something. It can just be something that the reason why you think changing Sentara is important. And I think it was really powerful. You get to know people that way. To Justin's point about not being able to connect as well anymore because we're not in person, you hear things about people and now your level for empathy goes up with them because you told me a story. You feel more personal with someone, more personally engaged. I think actually the change stories have been a great catalyst for feeling like someone deeper, and now you're going to work better together because you have some sort of connection with them, a shared connection maybe through a change story, or it's just a conversation starter too, now to get to know someone a little bit better. And I think that's been a driver for it. So when we talk about it, I think starting with that change story then starts conversations internally as well, which I think are, just kind of builds on itself. And for the culture to change, it's like been a catalyst for the culture to change too, is the concept of this.
Yeah, absolutely. I would say the 2 words that come to mind are empowerment. Transformation is an opportunity for not only new employees, but employees who have been there for, so one of my team's got 22 years of experience at just Sentara, which is incredible. And she has a ton of wisdom and a ton of things that she's seen, like areas for opportunity. Now is the time to get some action behind some of those opportunities that she's seen. That's empowerment. And I would say the other word that comes to mind is accountability, because I think, in other organizations I've been a part of, everyone, I don't think intentionally, but everyone sort of in a path of least resistance way just says, not my problem to solve. I'm in HR. I like this finance problem isn't my deal, or I'm in finance. Like HR isn't part of my deal. Like I rely on them to do. And there's some truth to that, I think, because if you think about a sports team, like everyone plays a position, and if everyone kind of does it well, the team wins. But at the same time, and I'm going to liken it back to the soccer analogy, because both Dennis and I play soccer, we enjoy it. But if I'm playing like a striker position, that's my position on the field, and I'm doing it so my team can win. But if my sweeper falls down and I have the ability to get back and save the team from getting scored on, then damn straight I'm going to get back and do it, because that's, So I think there's some balance in that. And I think and accountability comes back to just how we play on the field together. And I think it's been something that I've coached my team to just empower them and also hold them accountable and hold me accountable too, because I'm part of it as much as they are.
Yeah, I mean that's that one Sentara philosophy too, kind of like live down. Justin's example of it doesn't matter what division you're in, we are one Sentara. This impacts our whole bottom line and our ability to deliver care in our communities. So, yeah, it's a great analogy.
And the consumer doesn't think about it any differently. We one thing that was crazy to me was how we talked about health insurance and the health insurance industry. And if I invited any random person off the street to come into one of our meetings, because this is the way we think about it. We say, okay, that empty chair is that like average Medicaid member or Medicare member, whatever, how would they think about the way we're talking about this problem and how we're trying to solve it? It's baffling to think about.
To that point of who is that person in the chair, right? So, and you've had a chance to go to our CX studios and see the voice of the customer research. So we have a great partner with our CX, and they have a space in Virginia Beach near where we're headquartered, and actually have like a two-way mirror so you can watch the focus groups going on, and they have their CX testers and the voice of customer research, and they're bringing in groups, all different types of members and patients as we have, and getting their feedback on our experiences and our portals and our materials. And it's just amazing to hear the feedback. And I think we do get lost in that bubble of, we'll say it's an elitist bubble, but we forget like, how is the average person going to interact with this? And it takes a lot to, again, bring yourself, get that humility back and understand that I'm not going to know the answer to this. I have to go ask someone else. And I think we've really finally started to embody that with our CX teams and bringing that research to the forefront. Doing the competitor parity analysis just like we've done like last year with the health plan portals, and that type of work we didn't do before.
Sure.
And so you're relying on just what 2 or 3 people think would be the best thing in the room when you have thousands of people who you could reach out to tell you, and where we finally started, I guess, listening, which has been exciting to see that value of CX really finally kind of get its due. And I think, lead us to operating more like a retailer would. I started in retail as well before getting into consulting, and so I kind of grew up in a retail family as well. So sometimes I look around like, what, none of this makes sense to me. Like, none of it makes sense. But it's like, oh, it's because it's healthcare. It's like, well, okay, that to me is not a great excuse. It's all of this is an excuse. It's not a reason, it's an excuse. And I think that's one of the reasons that attracted me to come to Sentara when I had the opportunity to come here. And so, I think Justin's kind of the same way. I think we're both kind of eternal optimists types, right? So like, regardless of what's going on, we always feel that things can be better, and that's why we're here. And maybe we're not beaten down enough yet. We're still too new. Maybe, yeah, we're still too new, perhaps.
I think I just enjoy tackling problems, like big problems. Yeah. It's kind of a fun. In a weird way, it's kind of a fun thing to do, and it it gives you a reason, kind of like to what you were saying earlier, Dennis. Like, it gives you a reason to get up and get fired up about the work that you do, because you hear the stories, you hear these change stories or those moments like that were shared earlier, and everyone has them personally or with a family member. Just look at cancer in this country or in the world, really. And it gives you, how many people can show up to work saying, hey, there's a bunch of problems to solve, and every single day I get to try to tackle those problems, and the outcome is, maybe one thing that I do makes someone's life a little bit better. It's exciting work. I mean, there's definitely businesses that kind of have, or industries that have like a lot of, have matured so far along that there's the problems they're faced with, or like, how do we fix a lot of the stuff that we've already tried to like deploy? But that's kind of one of the things that is exciting about healthcare is how many areas of improvement there are. And the hardest thing is just where to focus.
For sure. I know we're running a little short on time, but I wanted to kind of close with this last question, and it's something we ask all of our guests, or it's basically recommendations. And I think this has been a fascinating conversation. I've heard of these sorts of things before, but to really kind of see how the sausage was made was great. I was wondering if you could share either books or videos or podcasts that have really kind of maybe helped inform or shape the Transformation Office and some of the work that you've been doing, some of your keys to inspiration.
Yeah, I have one quick one, I guess.
You go first.
But I have one. Yeah. It's not a healthcare book. It's a very old book. It's called The Effective Executive. It's a super old book, but there is one line in it. It's early on in the book, and the author is actually giving a healthcare example, and he says, the goal of healthcare should be to take the patient from the hospital setting to the non-hospital setting as quickly and easily as possible. Period. And that's it. Like, he's like, that's the entire goal of the industry, take this person from a hospital setting to a non-hospital setting as quickly and easily as possible. It's like, that's it. Okay. That's like, but that to me is like, okay, if we could make it that easy, that's the goal. So that, is odd reading it. It's not, again, I said it's not a healthcare book. It's a great book though. It's a classic like, business management book. But I think, that to me is just always stuck with me. I think I read that book about 2 or 3 years ago. It's like, oh, it's so, even 60 years ago, that was true, right? That's still our goal today. I will say though too, I don't know if there's necessarily like I think all podcasts or just in reading in general gets us thinking about different concepts and different ideas. But I think like a lot of it's just listening, like listening to my mother and father, they're in their late 60s, starting to come to some, health issues or needing more health care, and just listening to them talk about what they're going through and like some of the chronic, conditions, just listening too, I think to family members, friends also is that inspiration to, oh, I need to do my job better. I need to do my job better so my dad has a better experience when he needs an MRI, or I need to do my job better so my mom has a better experience, with her conditions as well. So I think that also is a little bit for me, it's just kind of listening to family and friends, because we work in the communities where our product lives every day. And so that to me is kind of inspiring. But I'll think of some more books and podcasts. But yeah.
Yeah, well, if you can't think of them, just send them. We'll throw them in the show notes.
Yeah. My answer was actually, my head was kind of going in the same direction as Dennis. And I love that listening concept. I would also include kind of observation about just great experiences wherever they may happen. So, like we flew here. Like as you're going through that process of booking the flight to, getting your seat, to checking your bag in, to walking to the airport, to buying that super expensive cup of coffee out of the Starbucks that has a line that's like longer than the flight to San Francisco or whatever. What are those like moments where you're like, wow, that was awesome. And why did that happen? So like the listening, and kind of taking it all in, but just observing in our day to day when we just go into just doing, because every day you're like buying things, going places, meeting people, so, and those can translate back into how you work with your teams, how you work with your partners, how you innovate, how you launch products to market, like all that's in it. So I think really digesting all of that and then seeing how you can use it in your job.
Yeah, it's kind of like teasing apart a system, right? And
right.
For its constituent parts and seeing what's a well-oiled machine, what maybe may cause some abrasion.
I think that's why a lot of us work in healthcare, and where other industries like, your ROI or, your EPS might be your goal, or like if I do this well, my options are going to hit, whatever, right? So I think just have a little bit of a different drive where the outcome is really our goal, right? And that's where I think, you could read whatever books you want to in other industries, like, whether it's Buffett or whoever, but when it comes to us, like we have to listen to our consumers, like just every day. That's just, we just don't have any other choice. And, we had some of those answers earlier today where I think it was your question of what would you have done differently 5 years ago? And I think some people responded to like, well, we just weren't really patient-centric or member-centric. We were focused on other things. We were focused on maybe saving money or some other, or acquisitions or whatever else. And now you're hearing that response almost ubiquitously of the member and the patient are now our focus. And I think that's been a good transition to like recenter people on why we're here and what we're doing. So
yeah, and there's that's like 50 books and one.
Yeah,
that's written by the world that's around you. It's free. It's free every single day. The other piece, and this has been, I just have found it exponentially important in my own like work and jobs at different organizations. It's all the same. Tapping into the gold mine, which is people around you who have been there for 20 years or have been from different industries, be it your peers, but also executives. You'd be surprised about how many executives, if you just reach out to them and they just ask for 15 minutes just to kind of learn and ask them for their advice, about what would they do and how would they think about the problems that you're sort of faced with today differently, they'll take you up on it. And that's like, I've probably talked to probably 30 executives that way, and they're like kind of words of wisdom. I call them my wow moments. I carry those with me, and that's like gold bullion when it comes to just solving problems and thinking about just how you service your consumers better in a deeper way, how you work with new partners, how you think, just have a broader perspective about the business.
There is one really good HBR article. It's called Managing Your Boss. And my boss sent it to me. I had read it years ago, but my boss recently sent it to a group of us. And it's really about finding out what's important, like what's important to your boss and your boss's boss. And that really kind of hones you in on those wisdom moments of what should I really be going after. It's very easy to get sucked into that day-to-day, monotony of, monthly reports or weeklies, whatever it is, weekly meetings. But we all need to really kind of look upward and start managing upward into our like strategic goals, and that will kind of drive you. You're going to get run down if you're managing downward into the teams too much. No matter what level you're at, you have to be looking upward. And I think, like to Jesson's point, I'm going to take that advice. Actually, that's a really good piece of advice to do that and start finding out what's important to those above you. It's that's not the only thing that matters, but it's a very important things that matter.
Well, that's great. This has been a terrific conversation, guys. Dennis and Jesson, thank you very much for joining the podcast.
Thanks so much.
Yeah, Matt, thanks for having me.
Thanks for listening to the Availity On Air podcast. I want to thank Jesson Zafar and Dennis Kramer for taking the time to share their experiences and insights. If you would like to be a guest on Availity On Air or pitch an idea, please reach out to me via email in the show notes. Availity On Air is edited and produced by Kevin McDonald. Guest and topic research was conducted by Jennifer O'Shea of SVM Public Relations and Marketing. This show is produced by Availity LLC. Okay, that's it.